Hello, my name is Victoria Lopez, and this is my presentation on drug addiction and overdose and the implications of this disorder in a public health view. In this presentation, I will be discussing what addiction is, addiction in the brain, national drug overdose deaths in popular substances, total national drug overdose deaths, prescription drug abuse, treatments, summary, with my sources slide. Okay, so first, it's important for us to understand what a person struggling with addiction means. The definition of addiction has gone through much change in recent years. Initially, drug addiction was not viewed as a public issue that only quote-unquote weak and lazy people were affected by. This stigmatization of drug addiction as a product of bad decision-making prevented the public from taking it seriously as a medical issue. Thanks to relevant scientific research, we now know that addiction can be defined as a chronic relapsing brain disorder characterized by compulsive drug seeking and use. The definition of addiction came about when scientists realized the effects of addictive substances in the brain. A pathway known as the mesolimbic dopamine pathway was found to be responsible for how dopamine signals are regulated throughout the limbic system. This image here is a positron emission topography showing the effects of a cocaine stimulus on the brain of a cocaine user. Neutral cues represent non-drug related activities as the control. You can see the difference in stimulation in the dorsolateral prefrontal cortex, proving drug cravings have a notable and medical effect on the brain. This graph shows the trend of overdose deaths in the US from 1999 to 2019 in several categories of popular drugs, both illicit and prescription drugs. As you can see, there has been a general increase in overdose deaths within the past 20 years, most notably in the synthetic opioids region. From under 5,000 deaths in 2012 to just under 40,000 deaths in 2019, opioids are the leading cause of drug overdose in America. This bar graph shows the total number of drug overdose deaths from 1999 to 2019. So you can see that even in the past decade, the total number of overdose deaths has almost doubled, from 38,329 in 2010 to 70,620 in 2019. There is a consistent trend of male victims outnumbering female victims. In fact, 68% of overdose deaths recorded in this time frame were males, and we can see that trend exhibited here. Drug addiction has been a public health issue in the United States for a while now. However, prescription drug addiction is a very modern health concern. We now see a massive spike in unintentional overdoses as a result of faulty regulation when it comes to these kind of drugs. This increase is most likely due to an increased leniency in drug distribution among pharmaceutical companies over the years. Prescription drugs have been used more and more for pain management purposes, with the risk of addiction rarely being communicated. This led to an extremely dysfunctional relationship between doctor and patient, where the patient was able to abuse the system and receive more prescriptions than necessary, many times from multiple different doctors. This lack of regulation is much to blame for the issues surrounding prescription drug overdose cases today. When it comes to recovery, treatment plans can be very complex and hard to come by. Recovery from drug addiction requires extensive medical intervention initially, followed by long periods of ongoing behavioral therapy. Relapse is, of course, a major concern in drug addiction recovery, and this chart shows how comparable substance use disorder relapses are with hypertension and asthma relapses. This data indicates just how necessary treatment is for recovering addicts. Unfortunately, in the United States, many treatment centers are highly inaccessible and staffed by unqualified workers. And obviously, acknowledging drug addiction as a medical illness is crucial in getting those afflicted with the disorder the help that they need. So, in summary, the discovery of the effect of addictive drugs on the brain gave way to a whole new perspective of drug addiction via the effects of the mesolimbic dopamine pathway. The rate of drug-related overdose deaths continued to climb to this day, with opioids being the leading cause. Overdose deaths seem to have a greater impact on men than women. Prescription drug overdoses are the newest and one of the biggest issues surrounding overdose deaths in the public health world today. And treatment centers for drug addiction need to be more accessible and normalized to help lower these increasing death rates. Thank you.